Good afternoon, everybody. Welcome to our Plan Year 2025 QHP Application Process webinar. My name is Victoria Fowler, and I am the administrator for the Compliance Unit here at the New Hampshire Department of Insurance. We are very much looking forward to our time with you today, and we'll be sure to set time aside at the end for any questions you may have. Please be advised that this is being recorded and will be accessible on YouTube within about 24 hours. Okay, so today we have our agenda here, and our agenda includes both state and federal timelines, guidance, tools, cost sharing, and rates, among other items for Plan Year 2025. There is one new item, our QTL template, and we will be discussing that later in the presentation. Today, our slideshow consists of 15 slides. This is a slide that shows our timeline for New Hampshire. The bottom is the New Hampshire Insurance Department key dates in blue, and the top are the CMS key dates in red. I will briefly go through this timeline. I will start with CMS. The early bird QHP application submission deadline is May 15th. From April 18th to June 7th, CMS will review early bird QHP application data. On June 12th, the initial QHP application is due. July 17th, the initial deadline for QHP rates for the QHP rate table template is due. From August 7th to August 21st, the issuer plan confirmation and submit final plan ID crosswalk is due. August 14th is the final deadline for issuers to change QHP applications. This is also the plan withdrawal deadline. At the top, you can see that between June 13th and July 12th, CMS will be reviewing initial QHP applications. And between July 18th and August 9th, CMS will review initial QHP rates and revised applications. From August 15th to September 9th, CMS will review the final QHP applications as of August 14th. On September 10th, CMS will send QHP agreements to issuers and the state will send the CMS final plan recommendations. There will be a limited data correction window for issuers between September 12th and September 13th. And between October 1st and October 2nd, CMS will release certification notices to states and issuers. Now moving to the New Hampshire key dates. April 2nd, we did release our issuer guidance bulletin for the 2025 plan year. And today is April 10th, and we are hosting this issuer webinar and Q&A. On May 7th, the initial forms and rate filings are due for on and off exchange. You may submit rate template placeholders, but must update these by June 10th. On June 10th, the initial rate templates and documentation must be submitted for the on/off exchange filings if a placeholder was used in the initial filing. July 10th is the initial rate revision deadline and also the deadline for off-exchange only forms and rate filings. At the end of the business day on August 1st, the final rate revisions are due. And on August 14th, New Hampshire will send the 2024 certification recommendations to CMS. Just to recap some of the dates, the binder submissions are due on May 7th. The early bird QHP applications are due on May 15th. Rate filings are due on June 10th if a placeholder was used on May 7th. And both on and on-off exchange and off-only exchange revisions deadline is July 10th. August 1st is the date for final rate revisions. Federal filing guidance. The CMS tools and guidance is found on this slide with links and information for issuers to submit QHP applications. CMS encourages issuers to download the toolkit and follow the checklist information during the application and plan certification process. State filing guidance. This slide outlines the tools and guidance our department provides to assist you in the QHP application process. Our plan year issuer guidance bulletin is located on our department website. The checklists, templates, and other relevant issuer guidance for QHP plan year 2025 is also found on our website. You can go to the department homepage and click on the link you see below in blue. I will now turn it over to David Scheckman for the next portion of the presentation.
Thank you, Tori. Good afternoon, everybody. I'm David Scheckman. I'm one of the file examiners here in the Life, Accident, and Health unit. And some of you may recognize my name or my voice, as this is my 9th season of QHP filings that I'll be reviewing. And to all the new people out there involved in QHPs, welcome to Plan Year 2025. So first slide that I'm to discuss about is in regards with rate filings. As New Hampshire operates a reinsurance program through Section 1332, carriers participating in the individual major mid market will need to file 2 sets of rates and include explanation of such rate assumptions in the plan year actuarial memorandums. One set will include rates with the waiver, which show the insurer's estimated actuarial impact that the waiver program will have on the insurer's plans for the upcoming plan year. The other would be a set of rates showing the anticipated rates without the waiver. Please remember that if you do not have your rates in place by May 7th, again, which is the initial submission of the binders and form rate filings for QHP, for the on-exchange and off-exchange QHPs. Let's see here. Please put a placeholder at that time and submit your initial rates by June 10th. And as mentioned before, final rate revisions are due by August 1st. Next slide, please. Okay, this next slide is in regards to network adequacy, and here's some tips and reminders filling out the template. First, review the guidelines and instructions that come with the template. Next, the template should only reflect the providers in your network that you have signed contracts with. Please remember, please put one network per worksheet. We do not want to see multiple networks on a worksheet. Please make sure that you review and include all pertinent information under columns K and L. This is in reference to the out-of-network providers and the in-network facilities. And also, please abide by the requirements set by CMS in regards to the URLs as it pertains to the SBCs, formulary, network, and plan brochures for each specific plan offered. And one last thing, Please make sure that the formatting is correct when filling out the templates. You should be using the numeric format. This will enable the tool that we use to read the NPI codes as well as the zip codes. Next slide, please. Okay, this slide is in regards to standardized plans. All carriers must comply with CMS requirements for standardized plans in the following metal levels: expanded bronze, silver, each silver cost sharing reduction plan variation, gold, and platinum. CMS has released 2 sets of cost sharing amounts for certain services under the standardized plans. Please remember to use the set which is applicable to New Hampshire. In addition, CMS has proposed an exception process where carriers would be permitted to offer more than 2 non-standardized plan limit, two non-standardized plan limit, if they can demonstrate that the additional plans have reduced cost sharing of 25% or more for benefits pertaining to the treatment of chronic and high-cost conditions relative to an issuer's other non-standardized plans offerings in the same product network type and metal level, and also service area, excuse me. Next slide, please. Okay, this next slide shows the cost sharing limitations for plan year 2025. And if anybody has been in this for a while like I have, this is the first year that I recall that the maximum out-of-pocket limits have been reduced. This year, it's $9,200 for the individual, and it's $18,400 for the family. The chart at the bottom of this slide also shows the reduced maximum annual limitations on cost sharing for the cost sharing reduction variation plans. We are still waiting for the cost sharing limits to be finalized from the IRS in regards to high deductible health plans. Next slide, please. Okay, this slide is in regards to the actuarial values. This slide shows the de minimis variation permitted as per CMS. For individual and small group market, you must have the actuarial value within plus or minus 2% of the standard actuarial value. In addition, there are variation limitations for specific metal levels. This includes the expanded bronze, which is +5 or negative 2% of the actuarial value. Silver plan is +2 or 0% of the actuarial value, and the income-based plans is +1 or 0% of the actuarial value. With that, I will be passing over the rest of the presentation to Quincy Gunn. Hey, Quincy.
Good afternoon. I'm Quincy Gunn, and I'm the newest member of the Life and Health Forms Compliance team with the state of New Hampshire. And this will be my first QHP season with the department. I'll be discussing some of our reporting tool and template requirements for this year. The first is the prescription drug rebate reporting. Issuers must file the rebate report demonstrating compliance with RSA 415A7 by July 1st. This will be required at least through next year and longer if extended. At minimum, the reports must detail how issuers comply by certifying if rebates are remitted pursuant to either 415A7-2A, which is where rebates are remitted directly to the covered person at the point of sale to reduce the out-of-pocket costs, or 2B, where rebates are remitted to and retained by the insurer. If retained by the insurer, the report must provide an explanation of how rebates are applied to the plan design and in future plan years to offset the premium for covered persons. This report can be submitted to NHID through CERP or via email at the email address you see on your screen. If emailed, please be sure to use the subject heading Prescription Drug Rebate Report. And next we have the CMS prescription drug tools. We've made some changes to our process for reviewing the results of the following tools. These CMS tools must be run by all insurers prior to submission to the NHID. The tools include the Essential Health Benefit Category and Class Drug Count tool, the Adverse Tiering tool, and the Non-Discrimination Clinical Appropriateness tool. We will be verifying your results and inquiring further regarding your justifications as warranted prior to transmission to CMS. So again, it's important that these tools are run by all issuers prior to submission. And then lastly, we have our quantitative treatment limit template. And this is the new template we mentioned earlier. It's brand new this year, and it's meant to gather necessary information to test the plan's compliance with MAPIA. It applies to both individual and small group medical benefits. Carriers will need to list covered services, identify quantitative treatment limits for each service, and estimate the total dollar amount the plan anticipates paying in claims in the next plan year for each covered service. The template includes all instructions and can be found and submitted via SURF. This is a completely new template, so please feel free to reach out to us with any questions or concerns. And that segues nicely into our next slide, which is our contact information with the New Hampshire Insurance Department. Please don't hesitate to reach out to us with any questions you may have. This is a list of New Hampshire contacts that will be able to answer your questions or get you the information you need regarding plan year 2025 QHP filings or any life and health form and rate filings. With that, we're ready for your questions that you have after today's presentation. Are there any questions?
I'd like to just reiterate that we are here to answer questions via phone or email anytime. We understand this is a complicated process, and we're happy to work with you in navigating this QHP season. Thank you very much for attending.
We did have one question come in.
Yeah, were there any changes to the NHID NA template?
And no, there were no changes. We are in the process of reviewing our network adequacy rules, and we are looking to update those rules either sometime this summer or this fall. But for this QHP cycle, there is no change in our rules or the template requirements.
Can you explain the network adequacy review with the new federal rules?
So for our network adequacy review, New Hampshire has its own template that it runs. With CMS, they are deferring to New Hampshire to run that network adequacy template. So we are the primary enforcers for the time and distance standards. In CMS and the federal standards have additional network adequacy standards, more specifically related to appointment wait times. CMS is the primary enforcer for those. So if you're looking at the federal requirements, CMS is primary enforcer. For New Hampshire requirements, New Hampshire is the primary enforcer. I hope that helps explain, but if you have something more specific, please follow up.
Thank you. I think that's all for this moment.
Thank you, everyone.
Thank you. We appreciate it. Hope to hear from you all.